Neurological Disorders Lesson 1.3, How Can We Study the Behaving Brain? The goals of this lesson are to introduce students to the most common modern-day approaches to looking at the brain, and to further explore the connection between brain structure and brain function. At the end of this lesson, students should be able to describe the techniques used to image the brain, name the benefits and drawbacks of each technique, and determine the most appropriate technique for different cases. We'll achieve our goals by analyzing a case study of Jessie and completing a jigsaw on brain imaging techniques. To prepare for this lesson, you'll want to review the key scientific concepts that will be presented throughout the lesson. They include techniques for looking at the brain, including MRI, fMRI, PET scans, EEGs, and autopsy. For each of the techniques, you need to be aware of what each shows, structure, function, how each works, advantages and disadvantages, and their common uses. We'll also discuss the relationship between brain structure and function. You can review the scientific content in the background reading provided to you in the teacher primer, teacher manual, and student workbook. The teacher primer provides in-depth knowledge about the scientific content presented in the lesson. The teacher manual or lesson plan provides a minute-by-minute explanation of the lesson structure, including instructions on how to manage the discussion and activity, and the student workbook provides additional explanation for students. You'll need to be sure to print the jigsaw readings, jigsaw worksheets, and homework worksheets for your students. The key points of the lessons due now are to review the relationship between brain structure and function, specifically that it's our left hemisphere that controls language, and that the left hemisphere also controls the right side of the body. We'll get there by a review of our homework, which was a case study on stroke. To complete the homework successfully, students need to apply their understanding of the relationship between brain structure and function to predict which areas of the brain were affected by a stroke based on a patient's symptoms. In this case, because the patient's symptoms are related to language and the right side of her body, then it was the left hemisphere that was affected by her stroke. The key points of the discussion are to provide a human connection and reason to investigate the imaging techniques. The discussion also allows students to further explore the connection between abnormalities with brain structure and abnormalities in brain function or someone's behavior. We'll get to these key points by analyzing a case study of Jessie, a 14-month-old boy. His case is fictional, and at the end of the lesson, we'll want to take a look at Jessie's actual brain, so we need to do an autopsy. Since we can't do an autopsy on a living person, unfortunately, Jessie has an accident. So what's Jessie's story? The discussion starts with you introducing your students to him and the fact that his parents bring him into the clinic because they're worried about his development. The class then discusses developmental milestones that most kids meet by the end of their first year. These are outlined on slide number 4, and you reveal to the students those milestones that are abnormal in Jessie's case. Those are in bold on slide number 5. You then ask the students, what has this behavioral information told us, what hasn't it told us, and what would you suggest for a course of action? Most students at this point take a wait-and-see approach and/or encourage a type of behavioral therapy. This information has told us there is a problem, but not what the cause of the problem is. Jessie's story continues a few years later when he comes back into the clinic. His developmental delays have not resolved, and he is now displaying certain attention deficit behaviors. You ask the students, what would you do now? Students at this point usually suggest ADD medication, which might help because Jessie is displaying those symptoms, but again, none of this gets at the cause of Jessie's issue. The key point of the activity in this lesson is to explore brain imaging techniques to determine what each shows, structure, function, and how, advantages and disadvantages of each, and when each is used. We'll get to these key points with a jigsaw on imaging techniques. Students will complete 3 jigsaw readings, which allow them to explore 4 modern-day techniques for looking at or imaging the brain. They are MRI and fMRIs, PET scans, and EEG. And caution, you'll want to be sure to double-check that the jigsaw readings are at an appropriate reading level for your students. To help students focus on the most important details of each of the technologies, give each student a jigsaw worksheet that has them take notes on those key points, which again are, what does the test measure and how, what are the test advantages, what are its disadvantages, and could it detect if Jessie's brain had a structural abnormality. You can review all of this information in the jigsaw worksheet answer key. It has everything organized just as your students will be organizing it. Additionally, the teacher primer and teacher manual go over all of the key scientific concepts about each of these techniques. After the students have completed their jigsaw reading and taken notes on it, you'll organize a teach back in which students will teach each other about the technologies they investigated. After the teach back, to help students refocus on the case study, you'll ask the class, what test would you order for Jessie? Students' answers will depend on whether they think Jessie primarily has a structural or functional abnormality. If they're thinking his problem is structural, they should order a structural test. If they're thinking his problem is functional, they should order a functional test. Most of the time, if doctors aren't sure, they'll order one of both, a structural and a functional test, just to cover their bases, because the two, structure and function, are linked. If a brain structure is compromised, so too will its function. And oftentimes, when we see a function compromised, it's because the structure controlling that function is compromised or abnormal in some way. The key points of the wrap-up are to show that autopsy can only be done post-mortem, and autopsy confirms structural defects. We'll get to these key points by performing an autopsy on Jessie and evaluating imaging techniques. In the wrap-up, Jessie has a horrible accident. He runs in front of a car and dies. His parents allow you to do an autopsy in his brain, which reveals that Jessie didn't have a corpus callosum. You'll also ask the students which of the technologies could have detected this. Since our best structural imaging comes from the MRI, that would be the best answer here. However, the fMRI does detect structure and function, so it too could be used here and would give doctors structural and functional information on Jessie. But fMRIs have their drawbacks, cost, and needing to restrain the subject, so it's not an ideal choice for Jessie, a young boy. Both PET scans and EEGs provide functional information, so it would be hard to use them to detect the structural abnormality of lack of corpus callosum. The key point of the homework is to review the relationship between brain structure and function. And we'll get to this by having students predict areas of brain activity. The homework is set up as a worksheet that prepares students for tomorrow's lesson, in which they'll be thinking about how the different structures of our brains work together to control behaviors. The worksheet has them outline the lobes of the brain and predict which lobe would be active as we do different activities. If students need help, they can go back to lesson 1.2 to review the functions of each of the lobes. Students often ask for more details about the technologies. You can find more in the teacher primer, teacher manual, and student workbook. One of the most common questions teachers get is, how do doctors choose one test over another? Some of the reasons doctors would choose one test over another include how fast an image is needed, cost of imaging, and potential harm to the patient. In terms of how fast an image is needed, if this is a case of head trauma or an emergency, speed is of the essence. And this is where you might have students with personal experiences because they probably had a CT, which is sometimes called a CAT scan, which stands for computerized axial tomography. CTs are done instead of MRIs in cases of trauma because CTs are much quicker than MRIs, but they use radiation and don't give as high a resolution image as MRIs. In terms of cost, MRIs, fMRIs, and PET scans are more expensive than CTs and EEGs. In terms of potential harm to a patient, PET scans and CTs both use radiation, whereas MRI, fMRI, and EEGs do not, so those have a lower risk to the patient, especially those who might need repeat scans. This lesson also brings up a common student misconception, that we use only 10% of our brains. While images from fMRIs and PET scans might give the impression that only certain areas of our brain are active, they're just showing us which areas of the brain are most active as we complete different tasks, not that we only ever use certain areas of our brain. So it's also important to address this misconception as you're discussing these imaging techniques with your students. At the end of this lesson, students should be able to describe how each of the four main methods work, but should also understand that there is no single method that provides both high-resolution structural and functional information. They should also be able to make a realistic choice of appropriate technique, not only for Jessie, but other cases where brain imaging is needed. The imaging techniques covered in this lesson will be utilized throughout the rest of the module, so it is important that students understand what each technique shows before moving forward. Don't forget, if you have any questions, concerns, or feedback, to let us know. You can contact any of the CTSE team members, and we'd be happy to help you.